As we age, life isn't always clear sailing. Aging touches each one of us, our parents, our children, and of course ourselves. Dealing with change or loss is an inevitable part of life. This is especially true as we age. When a significant life event, such as the loss of a spouse, touches our lives, the reaction to such an event varies from person to person. But what if such an event causes feelings of depression, anxiety, and isolation? What if these feelings result in difficulties coping? Is an older adult retiring from involvement in regular social activities a red flag? Is a decline in function reason for concern? What role does psychosocial assessment play in addressing anger, moodiness, forgetfulness, loss of hope, social withdrawal, and increased use of alcohol and drugs? Hello, my name is Attorney Ramsey Bahrawy, and welcome to Your Money, Your Life. Joining me to discuss the importance of psychosocial assessment and aging-related issues is Cathy Cress. She's earned her master's in social work and aging from UC Berkeley. She's a well-known authority in midlife siblings, baby boomers, and the aging family. She's the leading national expert in geriatric care management. In addition, she's the author of a handbook of geriatric care management, a text considered to be the Bible of geriatric care management. She also taught and lectured at Stanford, UC Berkeley, University of Florida, and numerous other universities and colleges. Ms. Cress is a prolific writer on aging, midlife siblings, aging dysfunctional families, and geriatric care. She most recently published a book called Mom Loves You Best. Cathy, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you for having me.
I'm going to ask you to, for a moment, focus on depression and anxiety. And can you explain how depression and anxiety are assessed in a psychosocial assessment?
Well, depression, let's take this lady who was recently widowed, and she's depressed, and she's lost her spouse of 60 years. And so what a geriatric care manager will do, or really any professional, aging professional, will use something that's really, the standard tool, and it's called a geriatric depression scale. And obviously it measures depression. There's 30 questions, and if your score is 10 or more, that means that you're depressed. And depression is really common in aging because there's so many losses. Anxiety is a little different, and anxiety is you use something called a Beck anxiety scale. And, these are really technical terms, but isn't your doctor using technical things?
Sure, of course, yeah.
When you go and you have, these amazing, x-rays. So it's sort of like an x-ray machine. And Beck anxiety scale, again, is a series of questions to find out, if you experience anxiety.
So it's based on what you just said, it's my impression that anxiety and depression actually have different symptoms and are measured by different tests.
Exactly.
Now, along those lines, can substance abuse be related to anxiety and depression?
Oh, it's incredibly related to it. I mean, let's just take our widow again.
Okay.
She's depressed because her husband of 60 years died. Well, that's a really normal reason to be depressed. And she's anxious because she's alone. It's scary in the house for her. Somebody's, he's made the coffee and she's made the eggs. And when you do that as a routine for 60 years, it's like, you're thrown into this whole panic attack mode. So people have sleep problems. They, out of it comes self-neglect, confusion, injuries, certainly if you're drinking, falls. So, it's incredibly related.
Okay. Does a psychosocial assessment have any tools to identify alcohol abuse, and if so, what are they?
Well, it's a really interesting one, and I actually kind of find it's funny. If you watch me on YouTube, I laugh about it too, because it's called Cage. And it's, again, it's your standard tool for, trying to find out if there's alcohol abuse. And as we all know, drinkers prevaricate a lot. So
You,
it
you, you
isn't
mean
though
they
you're really
deny?
going to get to the bottom of this. But Cage is a screening tool. And what's the C? The C is, have you, and this is, it's a question, there are four questions. So the first one I would ask the widow would be, have you ever, this is C, have you ever felt like you were going to cut down on your drinking? That's the C, cut down on your drinking. And that, it's a question that prompts, thought about, maybe I'm drinking too much. The A in Cage is, and this is the question, have people annoyed you by criticizing your drinking? Because
Okay.
usually, unless there's been an intervention, people haven't, um, sorry, my phone. People haven't, come to the point where they give you little hints, and it annoys drinkers because they want to keep on drinking. The G is, have you ever felt guilty about your drinking?
Mm-hmm.
And the last part is E, and and I think this is the funny. It's funny in an incredibly sad way, but the E is, have you ever had a drink the first thing in the morning? Which obviously measures the lowest point of, or one of the lowest points of alcohol abuse. So CAGE is the routine and the standard good housekeeping test for drinking.
Okay, so Cage is really the method. Now, does Cage, it appears to me, relies on the person that you're questioning actually telling you the truth, though, doesn't it?
Well, that's what I said at the beginning. Most drinkers do not, they're in denial. So they're not going to probably tell you the truth. With an older person, there may be a late stage onset of alcohol abuse. And so older people may be more honest about this. I mean, as all of your
Mm-hmm.
organs begin to age, your and your liver especially absorb alcohol in a different way. So you may have been able to have 4 glasses of wine a night, but now you're having two and you're drunk. So older people may actually be a little bit more honest if they haven't had a long history of drinking, just because you're able to absorb so much less alcohol as you age,
Okay. Now,
or drugs in general.
in a psychosocial assessment, can you also, is there also a test, as there is with alcohol, is there a test for drug abuse?
Yeah, you can ask a series of questions, and again, are they going to tell you the truth?
Mm-hmm.
Probably not, but you can give it a try, because drug abuse is much more common among older people than alcohol abuse. And why? Because physicians prescribe a lot of meds for older people. They don't
Yeah.
necessarily need all the meds. That's called polypharmacy. And so, you ask, these some really basic questions. So when a geriatric care manager or an aging professional goes in, you would ask to see all of their meds. I mean, could you bring them out? And sometimes you have to go rooting in
Mm-hmm.
shoe boxes that are
Mm-hmm.
filled with dog poop. I'm laughing about that. And then once all the meds are out there, can you describe to me, and you're asking the older person this, let's say our widow, why do you take them? Do you know why you're taking these meds? How often do you take them? Can you really say? And, you can just look at the labels and see, exactly, what the dosage is. And then you can ask permission, and you have to ask permission for this. Can you look around
Mm-hmm.
the house for older meds? And that's what you find all the time is, older people stash drugs for, the earthquake, when,
Wow.
and especially over the especially meds that are really dangerous. So if you have permission, you look in the bathroom and the medicine cabinet. You look through the bedroom, in drawers next to a bedside table. Um, so you have to build up a great deal of trust with this older person to really, get through this whole thing. But that's actually drug abuse is much more common than alcohol abuse with older people.
Kathy, I think that's a great place for us to stop.
Okay.
Older adults want to stay healthier longer, enjoy life while living in their homes. Today, people aged 65 or older represent one of the world's fastest growing populations. It's a population that requires unique medical and social services. This population, especially as its members reach the end of the life cycle, is vulnerable and needs services. This is especially true when dealing with a significant life event, such as the loss of a spouse. Although the reaction to such an event varies from person to person, it's not uncommon for feelings of anger, depression, anxiety, and isolation to appear. However, if these feelings result in difficulties coping, other issues may surface, such as isolation, decline in function, forgetfulness, loss of hope, and increased use of alcohol and drugs. This is where psychosocial assessment can play a significant role. As we learned from my guest, Cathy Cress, psychosocial assessment is an evaluation of a patient's mental, physical, and emotional health. It measures changes in a person's life and coping system. The psychosocial assessment also measures the level of available social supports and seeks to fill holes in the safety net. The psychosocial assessment usually takes the form of a series of questions asked by healthcare professionals. This assessment is used to create a comprehensive picture of the patient in order to map out treatment goals. Most patients have undergone a psychosocial assessment at some point in their lives. For example, the series of questions a doctor and the other medical staff members ask during a yearly checkup are a basic form of psychosocial assessment. With increased longevity, improved medical care, new hips, knees, and heart valves, we will all ultimately need to come to grips with the lessons of aging. So take charge of your future by doing your homework, for as Ben Franklin is quoted as saying, an investment in knowledge always pays the best interest. In closing, thanks to my guest, Cathy Cress, a national expert on geriatric care management, and as always, thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, Building Your Trusts.